in between, please do. And yeah, so I'm hoping some of these, this presentation. Okay, so let's start to discuss about some of the context here in BC. As we saw last spring, there were thousands that were forced to evacuate in BC in this a huge flooding that went on in the Fraser Valley. And events like these are not becoming common. I mean, we're starting to see a lot more chronic flooding, not only inland, but also in Vancouver. And if you recall, a couple summers ago, we had wildfires that devastated the province like never before. And they said it was historical wildfires. It was some of the worst we've ever seen. And then, of course, the following year, we had more wildfires. And we were in a state of emergency for 11 days. And, you know, we saw headlines like BC was currently at the worst air quality in North America. And I think you will agree that this is very appalling because we live in one of the most livable cities, livable provinces in not only Canada, but also around the world. And if we look at some of the sea level coastal maps and some of the scenarios that they've been projecting, we know that this is some scenario data of 2050, and assuming a 1 meter sea level rise, we see headlines like, you know, coastal communities like Vancouver are in a race against time. And not only are areas like Kitsilano, False Creek, Stanley Park going to be receding, but also we're going to see areas completely submerged in Richmond and Delta and along the Fraser Valley. And then last February, there was a report that was released, and it said that BC lacks climate change policies, especially on wildfires and flooding. And this is despite all the emerging chronic hazards that we're seeing. And that British Columbia has not completed a comprehensive risk assessment, according to the Auditor General. So the way we can see this, the way we can frame this problem is that we are seeing an increasing frequency and magnitude of natural hazards because of climate change, or what they call, you know, a new climate reality. But what's happening is that there are disproportionate health impacts within a city. That just means that within British Columbia and within Vancouver, different neighborhoods are going to be more or less vulnerable. So the way we frame this problem is that it's a health and spatial equity issue. And not only does this impact our local goals in Vancouver to be more resilient, to be more green, to be more healthy, but also impacts international goals, such as Sustainable Development Goal 3, good health, 10, reduce inequalities, and 11, sustainable cities and communities. So this is our Vulnerability Mapping Project. It's a project that comes out of the Ministry of Health, Office of the Chief Ministry of Health, and it's funded from the Health Protection Program. Dr. James Liu is the lead from the Vancouver Coastal Health side of things, and he put in this proposal, which got funded, and this is why we have an advisory team from Vancouver Coastal Health and Fraser Health that you can see. And on the UBC side of things, so this is our research team, Michael Brower, my supervisor, is the lead on that, and he's asked me to help coordinate and manage the project. So I'm working with an interdisciplinary team of other expertise in geomatics, in wildfire smoke, some of you know Angela, in flooding, so forth. So you may ask, why are the health authorities interested in a project like this? Well, I guess traditionally the question has been, you know, where is public health on climate change? You know, they usually respond when there's wildfire smoke, when there's extreme heat. They already work with local governments, but they don't work directly on climate change. They may have some healthy built environment teams, but projects like these really raise the questions, you know, what is the role of local public health in the climate change response? Is it a matter of reframing? Is it a matter of providing local evidence? And I think this project is kind of a response to that. So the specific objectives of our project were twofold: to identify climate change related risk factors at that local community level, as we talked about, so looking at that within city variation and vulnerability, and also to create vulnerability index scores to map these risk factors across the two health regions. So the hazards of interest were flooding, sea level rise, extreme heat, wildfire and smoke, and ozone. And these were chosen because not only were they of concern here in BC, but also of interest to the members in the Health Authority. And before I continue to discuss about the methodology of our project and present you the results, I want us to be on the same page as to what I mean when I say vulnerability. So I'm borrowing this figure from the WHO operational framework for building climate resilient health systems. And the way we can understand this is that, a health system in Vancouver, there are some chronic stresses, like the flooding. There are the acute shocks like the wildfire smoke. And they challenge our health system. And our capacity to deal with it are responsible of three components as to what we consider in vulnerability, or how we conceptualize vulnerability. We can understand them as exposures, like the climate-related exposures, such as extreme heat, ozone, and different sensitivities. So there are underlying physiologies that make us more or less likely to feel the impacts of these exposures. Age is one that's commonly known. So the elderly, the young, they may feel the impacts of extreme heat more. And adaptive capacity. So these are the individual and collective resources that a community or individual has that makes them more or less likely to be able to respond to these impacts. So moving forward, we will understand vulnerability as these three components and a mixture of those. And we can have negative adaptive capacity, positive adaptive capacity, and that will impact vulnerability. And ultimately, it impacts the choices and opportunities that we have to either transform, recover, collapse when a natural hazard occurs. So, well, actually, does anyone have any questions before I move forward? We're okay? Okay, great. So now let's discuss about the overall method that we implemented. So the first thing we did was that we used a systematic literature review. And this is just to identify any social demographic, infrastructure, resilience, health determinants, and data for each natural hazard of interest. And then we tried to collect as much data as we could and then deposit it into a repository. Then we aggregated the data to a consistent geography of interest. Before we developed these vulnerability measures that I'll present to you later on sea level rise, flooding, extreme heat, wildfire smoke, and ozone. And then we mapped it using GIS and data visualization tools. So, first thing we did was the systematic literature review. And this is, again, just to understand what was the epidemiological evidence on which risk factors were more important when it came to these hazards. And I'm just going to show one flowchart as an example using extreme heat. So we had our original search strategy. We searched on PubMed, Medline, Web of Science, and we had, for extreme heat, over 2,000 results. And then we used our primary inclusion to exclude them and then review the abstracts. And then it further excluded them. And then we had a set of key epidemiological papers that we reviewed in full before we further excluded ones we felt were not appropriate given our inclusion criteria. And so for extreme heat, we had 102 papers out of over 2,000 search results for extreme heat. And this is just a summary of the other results that came up. So overall, we had 281 epidemiological papers that we included out of over 28,000 search results, and most of them came from ozone. There was just a lot of papers to go through. Needless to say, obviously this took a long time. But we managed, and once we had all the determinants and risk factors that we felt were appropriate given our data-driven method, we then needed to categorize them. And so we came up with these subheadings, and these were chosen because they were common across all hazards, and we wanted common subheadings so that we could compare across the different hazards. So we have our basic socio-demographic characteristics, but also things like climate exposures, existing health conditions, the built environment, and institutional setting. And institutional setting are things like whether a community had a response guideline in place, a mitigation guideline, whether they had appropriate emergency supplies, etc. And then we categorize them into those broader about capacity and sensitivities, and examples can be like land surface temperature for exposure, pre-existing health conditions for sensitivities, and adaptive or housing for adaptive capacity. And I'll give you more examples of the ones we included in a later slide. And altogether, these categories will fulfill the different index scores that we're going to create. So each index score would have these different categories. So we have all the risk factors that we had collected from our review. We categorized them, and now we needed to collect as many data sources as possible that we could find. And we looked to our networks, our connections, to look at what are the data sources, and primarily publicly available ones if they were available. And these are some of the examples, not an exhaustive list of the data sources that we used. And overall, we collected more than 35 different indicators. And again, these are just some examples. So for exposures, we had daily max temperature and ground level ozone from CANU, and land area and floodplain from City of Vancouver and Fraser Basin Council, PM 2.5 concentration from a model that was made from one of our team members, Angela. For sensitivity, we had age from census, pre-existing health conditions from the BC CDC Chronic Health Disease Registry, and also from My Health, My Community survey. And then for adaptive capacity, we had housing quality and public transit from the census. The green space was from CANU, and social network was from My Health, My Community. And these are just some examples, but if you have any questions about where other data sources came from, you're more than welcome to ask. Okay, so I can hold off if there's any questions at this point. Okay, that's good. I hope that means that I'm explaining everything okay. So then to the next approach, we needed to create the index scores. And we wanted to use a data-driven method to create these scores to be as objective as possible. So the method we used was principal component analysis. And PCA, some of you already know, is a method to simplify large data sets by grouping and weighting the variables into what they call principal components, which would allow us to create these measurable vulnerability indices. And once we had these indices, we could then categorize them into quintiles from 1, very low vulnerability, to 5, very high vulnerability. And you may ask what we mean by weighting the index. Well, I think there's a lot of ways that we could have weighed the exposure, adaptive capacity, and sensitivity. And we've seen in the literature, some people could just weigh them equally, across the board, give them a third of weighting each one. But a lot of people argue, or in the literature, that maybe that's not the way to go. Maybe exposure should have more weighting, so forth. And the way we decided to use was PCA, again, just to be as objective as possible. And this is an example of the PCA weighting that we got for extreme heat. So we have around 40% for exposure, 33% for adaptive capacity, and around 27% for sensitivity. And so that's our way of being as objective as possible for our indices. And the last method that we could have done as well, and I will show you at the end of this presentation of our interactive tool, was that we wanted to give flexibility with that weighting. So let's say, I know that in a previous study in San Francisco, what they did was they gave exposure 40%, and then the other three components in the index was 20%, 20%, 20%. In some ways, it was a little arbitrary, but let's say as a health authority, you have a set of weightings that you'd like to give. Maybe you'd like the adaptive capacity would have more weighting because you feel like risk factors in that, like housing, green space, density, those are all risk factors are in some ways amenable to changes where public health can intervene. So maybe you would give that a greater weighting. So at the end, I will demonstrate to you what we mean by flexible weighting. So the next schematic will just show you the number of vulnerability scores that we wanted to create out of our project. We wanted to create categorical vulnerability scores. So again, exposure, sensitivity, and adaptive capacity, and each hazard would have a score for each. And the reason we did this was we felt maybe also our target audience could be city planners, health authorities, etc. So maybe they would be more interested in knowing specifically where the populations lie for sensitive populations for flooding or extreme heat, or which communities are less adaptive to ozone, wildfire smoke. So that gives them, again, that flexibility to have these different scores. But overall, we also plan to sum them all together, and that would create the overall vulnerability score for each hazard, so flooding, extreme heat, wildfire smoke, and ozone. And at the end of our project, we have 16 different scores for each neighborhood across the 2 health regions. Okay, so now we have our scores. The next thing we wanted to do was doing the geospatial analysis to understand which neighborhoods are more vulnerable. And just for your reference, these are the neighborhood scales of interest. So we wanted to map it using dissemination areas, and those are just neighborhood that from Stats Canada that consists of a population between 400 to 700. And the reason we chose this was because that was the finest spatial scale that we could have, and we thought that if we wanted to aggregate up later on, we could. That just gave us that flexibility. Of interest to Vancouver Coastal Health was to also map it across the My Health, My Community municipalities or neighborhoods, because that made more sense to them in terms of health service planning. So I'll start to show some, oops, is that okay? Webinar? Mm-hmm. Okay. So I'll start to show some of the results. This is something you saw in a zoomed-in version of Metro Vancouver, but this is a little wider, using the data of scenario planning for the sea level rise of the year 2100, assuming a 1 meter sea level rise. And we got this from the City of Vancouver and Fraser Basin Council. And so you'll see here a little zoomed-in version, but we have a larger scale here. But essentially, similar to what you saw in the introduction, we do see areas that are going to be completely submerged, and a lot of areas are going to be receding. If we look at the results we got from our extreme heat as an example, here is the data we mapped for daily max temperature over 25 degrees over a 10-year period, City of Vancouver. And on the bottom here is the legend. You'll notice that's in quintiles. So the lighter shade shows that there's lower vulnerability. The darker shade shows higher vulnerability. And with this map, we notice the areas that have higher exposure. So, we have Richmond, we have Delta, White Rock, Langley, North Vancouver. These are the areas we've seen with our maps to have higher exposure. But as you know, vulnerability doesn't mean just high exposure. So we mapped our sensitivity index scores, and here we notice that areas like Delta, White Rock, Maple Ridge, are more sensitive to extreme heat. And in large part, that does make sense because these are areas with older populations that have more pre-existing conditions. And when we map our adaptive capacity index scores, we see this. And I think what was really surprising to me was how much variability there was just in Vancouver itself. And that was just shows about the spatial equity argument that we had discussed about. So now what we can do is combine the exposure, the sensitivity, and the adaptive capacity scores for our overall vulnerability scores. And we have a question here.
Yeah, just what are the quintiles? Just wondering whether in this case, since it's adaptive capacity index, then if high is better.
Great question. And the first time we mapped it just as is. We're like, wait a minute, high adaptive capacity doesn't mean it means low adaptive capacity means higher vulnerability. So we inversed it. So high in this case does mean that they have a higher vulnerability based off of the adaptive capacity. We did discuss about whether we should rename it to maladaptive capacity, or, there was some discussion about this.
Yeah. There's also a question here from the audience. It's, since we're talking about extreme heat, the question was, why extreme heat? When we think about extreme temperatures, why don't you look at deviations from the norm? So why don't you, for instance, look at extreme cold, or is this something that you plan on doing?
That's a great question. It wasn't in our project to do extreme cold or the extreme other. I think that's another question, but I think moving forward, and I will discuss about this, but we have used primarily, publicly available data sources. So something like this could be replicated for another hazard, we'd hope. Yeah. But that's a great question, because we also thought about that. But it's inverse in this case, and the darker shade does indicate that it's more vulnerable based off of the adaptive capacity scores. And it is interesting, as we said, with a map like this, what makes adaptive capacity are things like housing, density planning, green space. So when we look at a map like this, we can look at maybe potentially where are the areas to prioritize? Where can public health intervene? So again, like I said, we combined our exposure, adaptive capacity, and sensitivity scores to then have an overall vulnerability map. And this is what we saw. And if we look at the different spatial patterns, we do see that exposure does seem to largely show the different spatial patterns are responsible for the sensitivity populations as well. So what are the other things we can do? Well, in terms of geospatial possibilities, we could put the maps side by side and think about where are the areas of priority. So an example we could do is put all the maps of the overall vulnerability for each hazard together. So going clockwise, we have extreme heat, top left, flooding, ground level ozone, and wildfire smoke. And potentially what we could do is just look at all the areas of high vulnerability across all climate hazards. And the implication of that is, are these potential areas of priority? Another thing we could do is put exposure on one side and adaptive capacity next to it. This is an example for extreme heat. And potentially we could look at the areas not only of high exposure, but also low adaptive capacity. And the implication, again, of that is that maybe these are the areas to prioritize if you wanted to for public health. And the reverse could be said is that how about areas that are of high exposure and also are mitigated by high adaptive capacity? or also, what are the area of high exposures that have been mitigated by low sensitivity? And finally, what we can also do are put the maps together of all the adaptive capacity maps for each hazard. And again, we have the same hazard maps here: extreme heat flooding, ground level ozone, and wildfire smoke. And we can look at the areas that have all low adaptive capacity. And these are the potential areas, again, of high priority. So these are just some examples of things that we can do with these maps. I'm sure you could think of your own, and if you do, please share them. Possibilities in terms of looking at areas of action, really. Are there any questions before I move forward? No? Okay. Okay, great. So now what I'll do, as I said, is demonstrate that interactive data visualization tool that we made. And the reason we made this, again, was to disseminate these findings to a wider audience via an online platform. And I'll just switch my screen now. Can we see the Tableau dashboard? Yep. Okay. So this was created on Tableau. As you can see here, this is the entire study area, the 2 health authorities that we mapped across. And we wanted to make it interactive based off of, the different needs of the online, or the different needs of the different people that are going to be using it. So with the map like this, we can zoom in on a particular area. Let's say we're interested in zooming in on Metro Vancouver. And what we wanted to add was that what we could do is potentially hover over a particular neighborhood, and it would report, the municipality, the dissemination area, but also each of the scores that we had discussed about. So an exposure score, a sensitivity score, a adaptive capacity score, and also an overall vulnerability score. And here you can see, where maybe some of the overall score, where is that being driven by? And with this example, it looks like exposure and sensitivity driving the score. And we thought, maybe different people are interested in looking at it with different boundaries. So on the top right here, we have different geography types. So we can change it to municipality. And that would give the map according to different municipalities. And furthermore, we also have the option to put it into the local health area. And what we also did were to give flexibility to the different weights that we discussed about. Recall having an index score that has flexible weighting. And on the bottom right here, you'll notice sliders. And there's exposure weight, sensitivity weight, and adaptive capacity weight. So these are the results you're seeing according to the weights of 60% exposure, 20 for adaptive capacity and sensitivity. Let's say you believe that exposure should have a less of a score, and adaptive capacity should have a greater score because of what we discussed about. The map would change according to the index weightings and the different changes to that. So by the end of it, we'd hope something like this would be uploaded to Vancouver Coastal Health's platform. And of course, what's missing are a lot of labels, explanations as to how the scores are being created, what do we mean by different vulnerabilities, and I think that's part of the KT process that we're going to have to figure out when we engage with different communities to make sure this is actually user-friendly.
So there's another question. So do you see this, what you're doing, as a static data source, or can it be updated, or even think about generating in real time to provide first responders heads up for areas when they may need greater need for medical attention?
That's a great question. This is really a first step. So this is a first step to, and it is static, but the idea with this is so in terms of the UBC side of things, we hope to hand over this project smoothly to the BCH to allow them to update the data sources as needed. And so we'll be providing them all the scripts, and this is something that I've talked to James and Emily about, and they do intend to update this as new data comes in. So I'll discuss more about how we don't have air conditioning data, we don't have outdoor work data, and these are things that are going to be collected in the next phase of My Health, My Community. So of course, these data sources will be updated, and I think that will change, yes. But in terms of real time, that's not a question I can answer for now. Okay. So if there are no more questions, yep.
Thank you. Very cool. I'm trying to absorb all of the information, but I might have missed it. Does this kind of mapping, I know it takes into consideration, for example, that there's an older population in a particular geographic region that might increase vulnerability. But does it take into consideration the fact that Vancouver might have 200,000 people who are over the age of versus another region that has 200 people over the age? Do you know what I mean?
Yes, population weighted, yes.
Yeah, that it's one area in terms of prioritization might be the ability to have impact on a much larger group of people than some other regions that are less densely populated. A region that is less densely populated but that has a very older segment is vulnerable. But a place like Vancouver that has millions of people, trying to figure out if density is factored in.
Yeah, I mean, density is factored in for extreme heat and I think for flooding. And our region of study is quite large. And so the scales that we're seeing are all relative to each other. And so we're going to see higher populations, a higher vulnerability based off of such a large study area. And there were discussions of whether we should just focus on Metro Vancouver in itself because of what you mentioned, that there are still higher population in it and maybe it deserves a different look to or observation to it or study to it. But yeah, I think for extreme heat we did consider density and flooding because of systematic literature review, but not for the other two.
So there's some.
Yeah.
Once you open it up.
So once you open it up, it comes and it's great, I think. Just some interest in, could you share the link to Tableau with the audience because they haven't, or is it something?
We haven't finalized this. I literally just got this like 2 days ago, so we haven't finalized it yet, but we're hoping this will be uploaded within the next couple months. Yes. No, by all means, if you have any questions.
I was wondering if you could explain a little bit more about what went into creating the exposure, sensitivity, and adaptive capacity dimensions.
I could. There's a table I can show you of all the different indicators that we use. Maybe I can do that at the end, if that's okay. Because basically we had done a systematic literature review for each hazard, and so there's a list based off of each hazard. But yeah. There's a question.
Hello. Do you have metrics for the smoke, heat, ozone, flooding for each TA? And can you use your overall score for each TA to predict with reasonable accuracy those metrics, perhaps? Does that make any sense? So for example, does your overall score for smoke, flooding, ozone, heat, do those explain some of the metrics that you might be able to get for each of those variables in each EA?
That's a great question. I'm not sure. I'm not sure the answer to that. I know that. So one thing we have is our extreme heat overall vulnerability index score, and we have another extreme heat vulnerability score created by like an SFU group that doesn't have all the different variables that we have within our index score. And one of the things we had thought about is that we could look at the spatial correlation between the two to see how much similarities there are.
Yeah, I'm just wondering if you have the number of cases of heat stroke within a DA or something like that, and get maybe you'd want to do it as a rate, so the number of people who have experienced heat stroke as a proportion of the total population, and then see if your overall score reflects that data at all.
No, that's a great question. I mean, that could be another step to it. That could be something we could do. I mean, this is the first step, but that's a great idea. Yeah. But there is heat stroke data in the wildfire smoke index score. So. So with any project, there are some limitations. And with any indices, there's a decision-making criteria about what goes in and what goes out. And I think we just have to be cognizant that we did have a criterion that it may not represent the intended meaning. And I think we just have to be cognizant of that, really. And in terms of linkage of data, we just had a lot of data sources. And so there were some technical difficulties with that, and some areas had smaller counts due to privacy concerns and census, so we had to approximate some of the counts by using neighboring or neighbors or neighboring DAs, that's what I meant. And for data availability, as I mentioned, there was no air conditioning and outdoor work data, which were two indicators that were important that came out of our systematic literature review. And we can only imagine how the extreme heat map would look if we did have that source available. But there are some strengths. As I said, we use primarily population level open source data. And we did this because we had hoped this can be replicated in another city if they had wanted to. We use multiple sources of data, which helps with triangulating some of the results. And I think one of the strongest piece of this is that we engaged with VCH and Fraser Health ongoingly to ensure that the relevance of this work to the British Columbian context. So some concluding thoughts and questions. I've already gotten some, and feel free to give us more feedbacks. But are maps and information like this type of project useful? And for what, for whom? How can these maps be made more useful? And are there potential unintended consequences? So I presented this at another workshop, and someone asked, what happens if this tool, I think actually the workshop with Karen, what happens if this tool falls into the wrong hands, insurers, etc. Are there potential gentrification of some neighborhoods? And I think this is just something that we have to be cognizant of, to consider all the unintended consequences and thus to plan for them.
There's a question.
Sure.
So there's a question about the frequency of data collection. I'm just going to try to get it back. There's a lot of thank yous and kudos and work is being super popular and well received. The question was around the fact that you're getting data from census and asking if, and recommending that it's gathered quite frequently. And then there's also a lot of development and changes in Vancouver. So would you consider, or would it be a good idea to consider collecting other correlated data like crime or resources? And I lost the question, but it's okay, so I can just keep spinning off of that. So, 311 is another source of data that you can be using. So are you thinking about going above and beyond what census data can give you?
I guess based off of time and resource, but if you have data sources, then feel free to share them. You can share them with James and Emily as they continue on this project moving forward. This is where we kind of left it off at, but I think, of course, as more data sources come in, I think that would be great to update this map and see how it changes. And to look at future scenarios and to understand how do these vulnerability maps change based off of different scenarios moving forward. I'm just going to end it off and then we'll take the questions if that's okay, because I was just at a concluding slide anyways. But just to quote Mayor Kennedy Stewart, he says, "A changing climate is a reality and Vancouver needs to continue to be a leader on the environment." And I just, just to respond to that, if Vancouver does want to be resilient, and healthy city, and tackle climate change, necessary to tackle climate change, and we should acknowledge that. So thank you for any feedback that you have, and I think it was great that you had some questions throughout. That helps so that I'm not speaking just straight. And I don't know if I can stay too long as I have a meeting after, but there's my email. Feel free to contact me if you have any follow-up questions. Thank you.
Thank you very much, Jessica. I was very much looking forward to catching up with you and see how all the wonderful work that you've been doing. So yes, as explained by Jessica, we don't have that much time, so I will be taking a couple, 2-3 questions so that we can let her go, and I'll start with you, Theo.
It's just a quick one. I might have missed it already, but it's a green space metric included.
Yeah, so I think someone asked about the data sources. I can look for them for you.
And similarly, is a blue space metric included as well?
No, blue space is not included, but that's a great question. It just didn't show up in our systematic literature review. So as an example, this extreme heat. So, these are our categories that we discussed about. These are the subheading determinants that we had grouped them in. And these are the indicators we had wanted to use to operationalize some of these and the data sources. So I think green space for adaptive capacity, green space was in there.
Any questions?
Go ahead. Were these all weighted in some way in constructing these indices?
Yeah, population weighted, yes.
So each of these was just population weighted. My point is, you weren't saying that race and ethnicity was more important than building environment, for example?
In this case, yes.
Okay.
I think I was probably going to ask a very similar question, which is, I'm wondering in the adaptive capacity realm, whether there is one thing that is dominant, that is driving, making an area red versus not red. Do you know what I mean? Like, no matter what else you shift, FPS is always going to be. Do you know what I mean?
Actually, in response to also the other previous question, so it's a 2-step PCA process, and the first step was to decide between variables that were similar, so education and income as an example, and then we used PCA to decide between the two, which one was weighed heavier, and then we chose one. And then the second step of that PCA then decided on the weights of the individual variables in the adaptive capacity or sensitivity.
So which one is weighted more?
I would have to go through my results again. I have them, but I don't have them on my slide. But that is a very fair question, because one of the questions that came out of the health authorities is, can we map the individual data layers to show which ones are driving the results? And I think what we landed at was that we could show the weights of each individual indicator, say in adaptive capacity. And maybe that would give you a general understanding of that spatial pattern.
So I did have a question. And maybe we can put back your slide for people who have about your email, so people can actually get in touch with you for more feedback or questions. So my question is more related to when you were thinking about how to use this data and overlapping either different indices or overlapping different outcomes. But did you think about looking at from policy and planning perspective? Did you think about mapping what I call the sweet spot? So a place that is, great in terms of resilience and less, prone to have vulnerable indices, and then try to learn from that and then replicate it in other places that are more at high risk. Does that make sense? So trying to find what the best candidate would be, the most resilient one, and then learn from there and apply it for planning and policy.
Yeah, I think that's a great idea. That's a great possibility. I think that would be the next step forward. I think as we move forward with these maps, these kind of ideas and questions will come up, and the possibility of looking at sweet spot, yeah, that would be interesting. Yeah.
Do we have any other questions here? So if not, we are going to let Jessica run to her next meeting. Thank you very much. Please join me in thanking Jessica today.